Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. I'm excited to announce that our group metabolic coaching program has started, and we are ready for you to come and join us. Within this monthly program, we'll work together to not only develop your personalized plan to improve your condition of insulin resistance, lower your blood sugar, lose weight, re-energize your body, and keep you feeling your best self, but we'll also get you off of that fat diet hamster wheel for good by giving you a sustainable plan that actually works within your busy schedule to keep you in good health. And best of all, you'll be amongst a safe, encouraging group of cheerleaders there to support you along the way. The Mind Body Balance Collective is where you want to be. Head on over to drshayla.com/MBBC to enroll now, and let's get started today. It's tea time. Over the years, research has shown us that there are many benefits of the nutrient vitamin D. I wore my yellow today for those who are catching the podcast on YouTube, just for this topic. Studies have also shown that most people in the United States consume less than the recommended amounts of vitamin D. In turn, we see a significant rate of vitamin D deficiency, with almost 42% of American adults being deficient of this vital nutrient. These statistics are even worse in people of color, with the highest rates of vitamin D deficiency seen in Blacks at a shocking 82% of Blacks being deficient of this nutrient, followed by 69% of Hispanic individuals being deficient of this nutrient. So on today's episode, I'll be spilling the tea on vitamin D and how to use this nutrient safely to optimize your health. So what exactly is vitamin D? Well, let's start with the basics. Vitamin D is a fat-soluble vitamin that acts more like a hormone in the body than a traditional vitamin. It plays a vital role in various physiological processes, including bone health, immune function, mood regulation, and more, which we'll discuss today. Vitamin D is naturally present in a few foods, it's added to some others, and it can be found on the shelf at your local grocery store as a dietary supplement. It is also produced naturally when ultraviolet rays from the sun are absorbed into our skin and triggers the production of vitamin D. Vitamin D has many important roles within the body, which we'll discuss some of them today, including reduction of inflammation, as well as assisting in immune function to fight infections and helpful in regulating blood sugar. So let's delve into a bit of the science here. Vitamin D comes in different forms. However, the two most common dietary forms of vitamin D are vitamin D2 and vitamin D3. Vitamin D2, also known as ergocalciferol, is typically found in plants, but can also be human-made and added to foods, whereas vitamin D3, also known as cholecalciferol, is synthesized in the skin of humans and is also consumed in the diet via the intake of animal-based foods. Both vitamin D3 and vitamin D2 are synthesized and available commercially and found in dietary supplements or fortified foods in both plant-based and animal-based derived sources. If you're deficient in vitamin D, both forms can help to correct the deficiency. However, the D3 form is slightly more active and therefore slightly more effective for improving your levels than the D2 form. Now that you know the vitamin D basics, let's chat about some of those important health benefits of vitamin D. I'll start with bone health, as this is probably one of the most commonly known health benefits of vitamin D. But stay tuned, because you'll definitely want to know that I'll be spilling some tea for you on those less commonly known health benefits of vitamin D as well. When it comes to bone health, vitamin D promotes calcium absorption in the gut, to help us maintain adequate calcium and phosphate concentrations, to help with normal bone growth and strength, and to prevent complications of low calcium levels, including contractions of the muscles, cramps, and spasms called tetany. Vitamin D also plays a crucial role in bone mineralization, helping to ensure that calcium is deposited into the bones, making them strong and resilient. Without sufficient vitamin D, bones can become thin, brittle, and more prone to fractures. Bone related conditions that can arise from vitamin D deficiency include rickets and osteomalacia. Rickets is a bone disorder that affects bone development in childhood. It is characterized by bone pain, poor bone growth, and soft, weak bones that can lead to bone deformities. In rare cases, children can be born with a genetic form of rickets. However, most commonly, rickets is caused by a deficiency of vitamin D and calcium. Here in the United States, where a lot of our foods are now fortified with vitamins like vitamin D and calcium, rickets was not very commonly seen. However, this condition has not been eliminated, and children can still suffer due to a lack of vitamin D intake. Some contributing causes to low vitamin D in children may include lack of sun exposure, whether that may be due to darker skin, decrease in sun absorption, high levels of air pollution blocking those sun rays, the use of sunscreen to protect from skin cancer, or living in certain locations that may limit sun exposure. Other contributing causes of low vitamin D in children may include poor dietary intake, whether this may be due to poverty and lack of access to food, or caused by children who are on a strict diet or limit the variety of foods within their diet. I always like to remind my patients that our plates should look like a rainbow to ensure that we are consuming an adequate amount of essential vitamins and nutrients like vitamin D and calcium within our food. Children who are breastfeeding can also develop vitamin D deficiency, increasing their risk of rickets due to the low levels of vitamin D that naturally occur in breast milk. Now, I am a strong proponent for breastfeeding, so this is definitely not a reason to avoid breastfeeding, as this is super easy to supplement in your child's diet. The American Academy of Pediatrics, or the AAP, they recommend that all infants receive a vitamin D supplement unless they are consuming more than 27 ounces per day of commercial formula that has the vitamin D supplement already added. Vitamin D supplements of 400 international units per day are recommended for babies up until age 1 year old and 600 international units per day for children over 1 year old. So, breastfeeding moms that are listening, be sure to talk to your pediatrician about supplemental vitamin D drops for your baby. Now, osteomalacia is a similar bone condition that affects adults. Both rickets and osteomalacia are conditions that result from inadequate mineralization of the bones due to vitamin D deficiency, leading to skeletal deformities, fractures, and other complications. Osteomalacia is a disease that weakens the bones, making them soft and can cause them to break more easily. It is most commonly caused by low nutritional vitamin D intake, decreased production of vitamin D within the body, decreased absorption of vitamin D, inability of the body to process and metabolize vitamin D, and low levels of calcium and phosphorus. Adults with osteomalacia may have symptoms including muscle weakness, muscle wasting, muscle aches and pains, spasms, trouble walking, bone pains, frequent falls, and bone deformities. And keep in mind, as we age, our skin becomes less efficient at producing vitamin D, and we may spend less time outdoors, further contributing to the risk of vitamin D deficiency, which is why osteoporosis becomes more of a concern even with aging. As we can see here, our bones need vitamin D at every level of development, from childhood into adulthood into our aging years. So this tea today is for all of us. If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting, you know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you. Now, vitamin D isn't just important for our bones, it also plays a crucial role in our brain health and our mood. 2021 studies showed that more than 8% of American adults had at least one major depressive episode. This equates to 21 million individuals, with the highest rates being found in females and those aged 18 to 25 years old. Anxiety disorders are even more common in American adults, with studies showing that 19% have an anxiety disorder. This equates to over 40 million individuals. Now, we do know that depression and anxiety can be caused by a number of factors, and I encourage you to listen to Essence of Health Tea Time podcast episodes 7 and 8 on the tea on boosting your mental health with psychiatrist Dr. Elizabeth Samanda, and episode 23 on the tea about your brain and your work with neuropsychologist Dr. Nicole Murray to get the expert tea on mental health. However, research also suggests that low vitamin D levels are associated with increased symptoms of depression and anxiety. Vitamin D receptors are present in areas of the brain involved in mood regulation, such as the hippocampus and the prefrontal cortex. When vitamin D binds to these receptors, it can modulate those neurotransmitter levels, including serotonin, which plays a key role in mood regulation. Seasonal affective disorder, or SAD, is a specific type of depression that occurs at a specific time of year, typically with symptoms most often starting in the late fall and early winter when sunlight exposure is limited, and going away in the spring and summer. We know that when sunlight exposure is limited, this may affect our vitamin D levels, which in turn may affect our mood. Treatments for seasonal affective disorder include antidepressant medication therapy, but also include light therapy and vitamin D supplementation if you've been found to have low levels of vitamin D. One thing to keep in mind, while individuals with depression and anxiety may have lower vitamin D levels, vitamin D deficiency has not been shown to cause these conditions directly. So if you are feeling symptoms of depression or anxiety, please reach out to your local doctor or mental health provider for further evaluation and proper treatment, which may include medication therapy and supplementation with vitamin D. In addition to mood disorders, vitamin D deficiency has also been linked to cognitive functioning, including cognitive decline and dementia in older adults, as well as attention and behavior disorders in children. Adequate vitamin D levels are thought to support cognitive function by promoting neuroplasticity, which involves adaptive structural and functional changes to the brain as a response to injury, protecting against neurodegeneration or the loss of structure and function of the brain, and reducing inflammation in the brain. This highlights the importance of maintaining optimal vitamin D levels throughout life to support brain health, cognitive function, and help to prevent cognitive decline. Now, here is some lesser known tea for you. Research has shown that individuals with obesity tend to have lower vitamin D levels compared to those with normal weight. One thought behind this finding is that vitamin D is fat soluble, meaning it dissolves in fat. So it's thought that in individuals with an increased amount of fat cells, vitamin D is getting stored within this fatty adipose tissue, leading to lower circulating levels within other parts of the body. Now, get this even more interesting tea. There are some studies that have shown that low vitamin D levels may also contribute to the development of obesity. Vitamin D plays a role in regulating the storage and breakdown of fat in the body. So, when vitamin D levels are insufficient, it can disrupt these processes, potentially leading to weight gain and obesity. One note here, though, is that there is more work to be done in the field of obesity medicine, and particularly regarding the link of vitamin D deficiency and obesity. The research here is not totally clear on the causes. However, just keep in mind that vitamin D deficiency is a known occurrence in obesity, even if the evidence is unclear on the why. Also, as it relates to obesity and metabolic health, there is a connection between vitamin D and insulin resistance, a hallmark of type 2 diabetes and metabolic syndrome. Insulin resistance occurs when cells in the body become less responsive to insulin, leading to elevated blood sugar levels. Many studies have looked at the role of vitamin D in diabetes and have shown an association between low levels of vitamin D and an increased risk for type 2 diabetes and its complications. Studies have shown that supplementing vitamin D in those found to have low levels may help to improve one's fasting glucose level, reduce one's hemoglobin A1C level, and their insulin resistance score. Research is showing that vitamin D may help improve insulin sensitivity, helping the pancreas to stimulate insulin release, enhancing the work of our insulin receptors, and helping our cells to utilize glucose more efficiently. Let's discuss one more lesser known benefit of vitamin D: the benefits of our heart. Heart disease is the leading cause of death not only in the United States, but worldwide. Low levels of vitamin D have been identified in those with an increased risk for heart attacks and strokes. Emerging research suggests that vitamin D may play a protective role against cardiovascular disease by way of its anti inflammatory, antithrombotic or less clotting, and vasodilatory effects to sufficiently open our blood vessels and allow proper flowing of blood throughout the body, all of which are beneficial for heart health. One of the ways vitamin D may benefit cardiovascular health is by helping to regulate blood pressure. Hypertension or high blood pressure is a significant risk factor for cardiovascular disease. Studies have found that individuals with low vitamin D levels are more likely to have high blood pressure compared to those with adequate levels. Vitamin D may help lower blood pressure by modulating one of the blood pressure control centers within our body called the renin-angiotensin-aldosterone system, which can in turn reduce inflammation of our blood vessels and make our blood vessels work more effectively to keep our blood pressure within a healthy range. Much like the studies performed regarding vitamin D and metabolic health, when it comes to cardiovascular health, there is still more work to be done. While vitamin D has not been shown to reverse heart disease, has not been shown that it can be sufficiently used alone for treatment of high blood pressure, and has not been shown to prevent a heart attack nor a stroke, the evidence does show that having adequate levels of vitamin D may be helpful in possibly reducing your risk factors for these conditions. Now, you've been informed of all the health benefits of vitamin D, but don't take matters into your own hands without first having a chat with your doctor regarding determining your vitamin D level to find out if you're actually deficient or if your levels are already currently optimized. One way to assess your vitamin D status is through blood testing. The most common test used to measure vitamin D levels is the 25 hydroxy vitamin D or 25 OHD test. This test measures the concentration of 25 OHD in your blood, which is the main circulating form of vitamin D and considered the best indicator of overall vitamin D status. Vitamin D levels are typically reported in either nanograms per milliliter, which is ng/ml, or nanomoles per liter. The optimal range for vitamin D levels can vary depending on the source and dependent on your personal health, but generally, levels between 30 to 50 nanograms per milliliter are considered adequate for most people. Levels below 20 are indicative of vitamin D deficiency, while levels above 50 may be considered optimal for certain other individuals. It's essential to test your vitamin D levels initially And retest your vitamin D levels periodically to monitor your progress and ensure that your levels are within the optimal range for your health. I want to emphasize the significance of testing for vitamin D deficiency before starting any supplementation regimen. While vitamin D deficiency is widespread, not everyone needs supplementation. And blindly taking vitamin D supplements without knowing your baseline levels can actually lead to potential health risks instead of giving you these amazing health benefits. Vitamin D levels about 100 nanograms per milliliter are considered high and may pose potential health risk instead of benefits. Vitamin D, once again, is a fat soluble vitamin, which means it can be stored in the body fat for extended periods. If you're already getting enough vitamin D from sunlight exposure and diet, adding supplemental vitamin D could potentially push your levels into the toxic range. While rare, vitamin D toxicity can indeed occur when excessively high doses of vitamin D are consumed over an extended period of time. Symptoms of vitamin D toxicity can include nausea, vomiting, weakness, confusion, and even kidney damage in more severe cases. The symptoms of vitamin D toxicity can vary depending on the severity of the condition. With mild cases, you may experience more along the lines of nausea, vomiting, and weakness. And in more severe cases, you may develop symptoms such as confusion, dehydration, and kidney problems. So keep in mind that it is essential to approach supplementation with caution and to test your vitamin D levels before starting any supplementation regimen. Now, if you are found to have a vitamin D deficiency or insufficiency, discuss with your doctor a plan for optimizing your level. Let's discuss some ways to improve your vitamin D level. Sunlight is our most abundant source of vitamin D, as UVB rays trigger the synthesis of vitamin D within our skin. However, the amount of sunlight needed to produce enough vitamin D varies depending on factors like your skin type, your geographic location, the time of day, and the season. So it's challenging to optimize your vitamin D levels with just sunlight alone. And due to potential risk of skin cell damage and increasing your risk for skin cancer with prolonged sun exposure, it's not recommended that you depend on sunlight alone to optimize your vitamin D. Especially if you have risk factors for skin cancer or melanoma, opt for sunscreen use instead of trying to supplement your vitamin D from the sun. There are dietary ways to supplement your vitamin D intake. Vitamin D is found in fatty fish like salmon, mackerel, and tuna, egg yolks, fortified dairy and non-dairy products, and shiitake mushrooms. Now, while these animal-based foods can help with vitamin D, we also know that increased intake of dairy products, eggs, and meat can increase your risk for heart disease and other health conditions. So I wouldn't recommend consuming these foods for the sole purpose of increasing your vitamin D, as there are still better ways of doing this without causing additional harm to your health. If you're unable to get enough vitamin D from sunlight and diet alone, taking a supplement can be helpful to you. Vitamin D supplements are widely available and can be an effective way to ensure you're getting enough of this essential nutrient, especially during the winter months or if you have limited sun exposure due to factors like living in a northern latitude or working indoors. However, keep in mind that when it comes to supplementation, it's essential to choose the right form and dosage of vitamin D for your individual needs. So be sure to consult with your personal doctor regarding the dose of vitamin D you should take to optimize your health. And let's remember those lifestyle factors that can influence vitamin D levels. As we discussed, obesity can be associated with lower circulating levels of vitamin D due to our adipose tissue. So it's important to follow a healthy nutritional program and important to move our bodies, as exercise can be helpful for naturally boosting our vitamin D levels. Now that you've gotten this brightly colored tea on vitamin D, be sure to share the wealth by liking and subscribing to this podcast, and share this episode with your family, friends, and colleagues so that they too can reap the benefits. Remember, the essence of health is in you. Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.